Hey everyone, Dr. Kevin here with Balance and Body Restoration. Today, I just want to share some pretty important and really cool news about the clinic. I know that there's been, I haven't been in touch with a lot of you as much as I would like to have been over the past couple of years. But quite frankly, that's because a lot of you have, kept us, my wife and I, Twee, very busy because you referred so many friends and family to us over the years, and we don't take that for granted. We thank you very much for just kind of spreading word to, again, friends, family members, loved ones, and trusting them. Having trusting us with their health, and we wouldn't be in this position without a lot of you. So I just wanted to just kind of come out here and just say a quick thank you to everyone that's been a part of our journey for the past 8 years. And again, just to kind of share some pretty exciting news that we have coming up with our clinic. And the first bit of news is I wanted to introduce to everyone our first full-time clinical hire, Dr. Austin Bohnsack, who is a chiropractor, also a strength and conditioning coach, or what is it?
Strength and conditioning specialist.
Yeah, strength and conditioning specialist, who's going to be helping us launch the kind of the next phase of our business, which is a strength and resistance training program for people who want to stay strong, who want to be able to trust their bodies to live well, deep into their 50s, 60s, 70s, or however you want to be able to be confident within your own body. So I just want to take a couple minutes today just to ask Austin a couple of questions and introduce him to everyone. So let's get started. Austin,
Sure.
thanks for being here.
Thanks for having me.
So so I guess we can just start by just telling everyone a little about yourself, where you're from, and what led you to kind of get into this field of chiropractic, rehab, or strength training. Tell us your story.
Sure. So I was born and raised in Missoula, Montana. I played college sports, high school sports. I played sports all my life. Yeah, because of that, I was constantly getting hurt, going to rehab, getting hurt, going to rehab, yada yada yada. The reason I got into this field was because I didn't really have resources that were in place to prevent me from getting hurt long term. So I wanted to get into this field to kind of be that resource for everyone to, you get hurt, fine, come see me. We get you better. We hopefully keep you from getting hurt again.
Got it. So tell us more, because you told us a little bit, because you started off as a strength coach, and then you went on to get a chiropractic degree a little bit later on. Can you tell us a little bit more about that, kind of how you started as a strength coach, and just kind of tell us your kind of clinical evolution?
Sure, yeah. So before chiro school, I worked as a strength coach / personal trainer for 2.5, maybe 3 years. And in that time, I kept running into the same issues over and over again, where I'd be strength training with someone, we'd be doing good, then we'll just say one of the kids, for example, he would play basketball, he'd show up, hurt his knee playing basketball. And, with the strength coach hat, I don't know what to do. So I just have to keep referring him out. Finally, I kind of got tired of that. So I'm like, you know what? I need to learn more. I want to learn more. So I went to chiro school so I could kind of fill both of those shoes, be a rehab professional as well as a strength coach.
Yeah, amazing. And again, I know it depends on the person. There's a lot of people out there that believe in chiropractic, or chiropractic has certain things about them in terms of profession. I've always been of the belief, some of the things that I've learned, the best things that I've learned over the years have come from chiropractors. The SFMA, people that have taught me how to assess, how to evaluate, it essentially turned me to the clinician that I'm in. That system was developed by a physical therapist and a chiropractor. So I've always been, keen to certain chiropractors because they share very similar views, very similar philosophies, and that I would say that some people have certain misconceptions about certain chiropractic, and that is out there. So I'm not saying that's not true, where it's just, oh, they just kind of crack your bones and you're just kind of stuck there for the rest of your life. Whereas I would say that more kind of new age chiropractors, ones that are more kind of up to date on just kind of what people need to get better. If you want to speak a little bit about just kind of that in terms of the profession, kind of where you stand, what you've learned, and just kind of your approach in terms of bringing a chiropractic philosophy into a physical therapy rehab clinic.
So I'm going to keep this short. I think a good chiropractor and a good PT, you're not really going to be able to tell a difference. The chiropractor might be a little bit more adjustment heavy. The PT might be a little bit more soft tissue. There's going to be a little nuance, but overall, very, very, very similar.
Yeah, for sure. And so I guess if you were to talk about kind of what stood out to like our clinic and what made you want to join our team.
Yeah. So after school, I was looking for jobs, and I kept seeing jobs that were just typical chiropractic approach. Adjust patient, have patient come back in next week, have them come back and do that for the rest of their life. That isn't really my philosophy. I'm not really a fan of that. I don't think morally or ethically that's right. And when I saw Balance and Body pop up, I was reading down the bullet points, and just every single thing on there clicked with me. Philosophy wise, like the goal here is to take someone, get them pain free, get them moving better, fix their issue, and that's everything I want to do.
Yeah, awesome. So I guess let's talk a little more about just your philosophy or our philosophy and stuff like that. So if someone does come in with back pain, mobility problems, injury, what's the first thing you try to understand about that person, that patient?
Sure. So the first thing we're going to try to understand is where is your problem coming from? I think there's a little confusion. Most people are going to think the back is the thing causing the problem. If we take a bigger zoom out, what we're going to find oftentimes is the back is just a symptom, but the problem is somewhere on a different part of your chain. The chain being from kind of head to toe.
Yeah, got it. Give us some examples of maybe some things that you've seen that kind of illustrate that point.
Yeah, yeah. So even in my short time here, we've had a couple of people come in. Some people maybe they had total knee done, never really did any rehab on it. They came in here, they were having back pain, sciatica down into the legs, and we took a look at just kind of doing a bunch of soft tissue work around the knees, and almost instantaneously their back pain went away,
Yeah.
just like that.
Yeah, it's been the biggest like eye-opening experience in my clinical profession was to just learn to take a step back and see the body as a whole. And once you learn to zoom out and you start seeing all the different connections, you realize that when you are able to pinpoint that bullseye of what's actually causing the person's pain, not staying stuck treating that symptom, things can happen very quickly. I've seen it. I've made a whole career out of it, and hopefully, I've been able to help a lot of you guys just being able to pinpoint that root cause for fast, legitimate, and long term relief. But then we want to make sure things stay away. We don't want them to coming back either. So, and Austin obviously shares a very similar philosophy to us. Another thing about just patience. What do you think? I think it's maybe some overlap, but what do you think most people misunderstand about pain or injury, or what's one thing that you wish that more people would know about just their overall like health or common health problems that people end up with?
Sure. So, I mean, yeah, definitely going to be overlap. I think most people that come in here assuming, their back pain is the actual problem. We kind of show them like, hey, your problem is tight quads, maybe. Just as an example, fix the quad, pain immediately goes away. Mind blowing.
Yeah, mind blowing. It's again, and we've made a career out of it, and there's so much more to learn as well. The body is quite complicated, so there's always your room to just kind of learn more and kind of add more tools to our repertoire. So, if you could maybe tell us a bit about like the types of patients that or types of clients that you just kind of love working with.
Sure. Yeah. So, just a little bit of a backstory too. I've worked with people from about 13 years old to 76 at this point. It's crazy.
Yeah.
And at first I thought I really liked working with the younger, like middle school, high school athletes, but over time I'm kind of seeing, they take a lot for granted. I mean, yeah, it's cool to see the progress, but those kids, like realistically, don't really have any issues holding them back. They're just looking to get better at their sport. Where when you take the time to strength train, maybe like a young dad, a middle aged dad, or someone in a walker, and you can take that person from maybe the dad to being able to play with his kids pain free for the first time in years, or the person in the walker to walk without the walker for the first time in many years. It's just so much more fulfilling for me as a practitioner, and then for them, I mean, quite literally, it's life changing. There's no better feeling.
Yeah, and that's yeah, honestly, what same story. A lot of us as physical therapists, rehab professionals, we get into the profession because we were maybe injured as an athlete, and we envision ourselves working with athletes because we want to work with us at an earlier time. But through my clinical experience working in the hospital setting, rehab settings, nursing homes, skilled nursing facilities, I always I always at the time I didn't like doing that. I didn't like working with that type of clientele. But when I was in it, when I was working with them, you could just kind of see the improvement of just doing just a little bit for someone who might be in a compromised state. They've been bedbound just kind of after having had surgery a couple of weeks ago. You see what just the basic fundamentals of just safe, sound, consistent movement could do to change someone like that's life and their ability to be able to walk again, to be able to stand again. Like that's something that I'm so glad that I had those experiences, even though at the time I didn't like them because it wasn't what I was going to do. But knowing and having that experience to know what is possible for people has really kind of changed my belief, and just it's the reason why we work with the clientele that we work with, especially around here. So very cool. Could you share a moment or just a patient experience that kind of reminded you why you do this work, or just kind of solidified that, like, okay, this is where I want to be and what I want to do?
Sure. Yeah. So this is gonna go back home. I was training a guy. He was 70 when we first started. When I first met him, he was living in complete and total isolation for the last 10 to 15 years. Like, this was his real, I guess, quote unquote, first introduction back to society. And yeah, 10 to 15 years. I trained with him for 2.5 years, give or take. And in that time, I honestly just saw a completely different person. The first stage of our training was weight loss. I think he ended up losing 30, 40 pounds in the first year. Then after that, I went to a powerlifting meet, a national powerlifting meet in Palm Springs. He watched the live stream after that. He's like, that looks really fun. I want to get into that. So I'm like, all right, let's go. So then we train over the maybe, I don't know, next 7, 8 months, train him for a powerlifting meet. In that time, he was off riding his horse in the mountains. Keep in mind, at this point, he's 72 ish. He falls off his horse. And for anyone who knows anything about horse riding, if you fall off your horse, you're usually not having a good time.
Yeah.
Yeah, and especially at that age, like the biggest fear is broken bone, fracture, something like that. He got up, walked it off, no problem, was completely fine. Um, he after that went on to compete. He set a state bench record and a state deadlift record.
Yeah, amazing. That's again 72 years old, falling off of a horse, but because he had the strength, he had his bones were strong, because his muscles were capable, because his overall baseline of strength was in a better physical state, meant that he was able to essentially shrug that thing off as
Yeah,
maybe a
no
little
big
bit
deal.
maybe a little bit of good luck as well, but man, all that stuff that he had before didn't hurt his case in terms of him being able to bounce back from that.
Mm-hmm.
So yeah, so Austin started talking about a little bit of his background. Obviously, as you can all see, he is um, definitely not weak. Definitely a pretty strong guy, and he does have an extensive background in powerlifting. And one of the things that really drew me to him and why I wanted to join the team is because as of right now, and we're going to be sharing a lot more information with you all about essentially phase 2 of our clinic, which is our Forever Strong strength and wellness program. We're going to be teaching you guys, creating programs to help people who want to just get stronger and essentially strong for life. That's why we call it Forever Strong. So Austin here has the, he's obviously way stronger than me, but he kind of lives the lifestyle of a power lifter. Now, I'm not going to be saying that we're going to be trying to turn all of our clients into power lifters, but if you could just kind of speak on just the lifestyle of what is powerlifting, what is weightlifting, and what would you want our kind of past or current existing client base to know about what lifting could potentially do for them based on
Yeah,
your
100%.
experience?
Yeah, so powerlifting, we just straight up compete and squat, bench, deadlift, with the goal being do as much as you can. I don't recommend that for a lot of people. Just straight up, I do it for fun. I do it because I have a competitive itch I need to fuel. Otherwise, I just kind of get bored. As far as the strength training aspect of it, every single person on this planet should be doing strength training in some form or another. It's going to increase your bone density, increase your mood, increase your confidence. I mean, that list, I don't have enough fingers or toes to count on to keep going. It quite literally will improve every single aspect of your everyday life. And for the people that are going to say, we are going to meet you where you're at on strength training, I don't expect anyone else in here to powerlift. The goal is to teach you very basic movements like a squat, a hinge, a lunge, uh, like a push up, and some sort of row. And we just go from there. You know, until you've mastered your body weight, we're not doing anything else.
And the reason, like, why again, he's here is because he shares the exact philosophy that I have, in that we want people to learn how to do these lifts, not because we want them to be lifting weights, but because these are core functional movements that show up in everyday life. And when people stop being able to bend over and pick something up, when they stop squatting to get on and off the ground, when they stop pushing and reaching for things above their head, that's what's going to make people prone to pain or injury or setbacks or things to happen down the line. But if you're able to strengthen up the movement pattern of a lift or a squat, that not only is it going to, potentially prevent these injuries from happening, but you're just going to be able to breeze through life and doing the things that you want with just
Oh,
absolute
100%. Yeah.
confidence.
That's one thing I'll tack on too. You get stronger in here, everything in your daily life becomes 10 times easier.
Yeah, absolutely. And again, this is something that I've wanted to implement here for so long, but due to all of you just constantly referring friends and family, to come see us, we haven't had the chance to really gain a tremendous amount of traction. But we do have a lot of cases and people that we have been working with for years that we're really excited to share about with all of you. So stay tuned for what's to come. But so if you could, so that's definitely your approach to long-term healing. Um, and I just talked about the strength training approach, but what would what can patients expect if someone comes to see you for the first time? Maybe someone is coming back to see you, or maybe they've referred a friend or family member, or just maybe someone new that's just kind of watching this video. What would the experience be like, kind of just
Yeah,
working with you?
100%. So they're going to come in, we're going to do introductions and all of that. Then we're going to go into a treatment room. We're going to sit down, we're going to take a brief but very intense history. What brings you in? How long has this been going on for? Have you seen anyone else for it? The biggest thing is like what goal do you want to be able to do that you can't do right now? And then from there, we're going to take you through a little movement screen. The movement screen is going to give us a pretty good understanding of where your problem is occurring. And from there, we'll do a little brief kind of soft tissue hands-on work to show you we can make an improvement that quick. And then from there, it's on you whether you want to continue or not. We just to let you know, we will always be here should you change your mind if you choose not to.
Yeah, thanks for sharing that. So yeah, so he's obviously trained in the philosophy of what we want to do, and I'll tell you a little bit of backstory. The reason why we hired Austin on his interview is because I was actually having some issues with my back, sciatica. Had another gout flare. I know some of you may know my personal backstory with gout flares. Some of them I'm still dealing with, to this day. And I was having a flare. I was on crutches. My back was all kind of crooked. I was kind of hunched over. And he came in for an interview, and I was kind of struggling that day. I had quite a bit of back issues. My back was really tight. I had been limping for a couple of weeks, and I said, "Hey, no better time to test the skills. If you can assess me and help me figure out what's going on and help me, then we'll just kind of see where he's at." And again, as someone such as myself who's more, I'd say, focused on soft tissue, things like cupping, massage, stretching, doing the right exercises, he took a chiropractic approach to what was going on. There was some stiffness in some of my joints, my ribs, and my shoulders, and my upper back. And he said, I think I know what's going on. And I had him do what he thought was best. And I swear to you, my back pain, my back spasms, my movement were better almost immediately, to the point where I offered him the job like right then and there. So in terms of someone that I just kind of know, trust, is gonna just kind of do the right thing, and if he doesn't know it, he's gonna look for the right thing. I put my absolute faith and confidence in this guy to be able to help you or anyone else that you may refer. So that's that. Um, so yeah, so I guess what excites you the most about working in this kind of like East Bay Tri Valley community as a
Sure.
Montana boy? What are you doing out here in the East Bay, and what are you excited, in terms of just kind of working out here, and what this beautiful area of the world just will present you? What excites you about here?
So I've already had the opportunity to work with a couple of the wonderful ladies here, and every single day they come in, it is a fantastic experience. They show up, they are here just to get a good solid workout in. They come in, work out, don't complain about anything, do the work, and honestly, above all else, just they have a really good time. When they're having a good time, makes me have a good time, and everything just goes significantly better.
Great.
And yeah, just the community as a whole has been absolutely fantastic so far.
Yeah, happy to hear. And again, now that we have a guy like Austin here to be able to help us out, we're going to be able to help a lot more of you. And again, we're still in the early stages of kind of building up this program, but we want to make sure that you all know about this program first. It's going to come soon, so just please stay tuned for all of that. So yeah, so last question, it would be maybe a little overlap from the question before. For anyone that might be a little nervous, seeing someone new, they're
Sure.
kind of used to seeing me. Been here for about 8 years now. What would you want them to know? Again, if it's a recurring client or someone referring someone to you, like what would you want someone to know that
Yeah.
that might be a little anxious seeing a new face around here?
Yeah, that's fair. I guess the biggest thing, this has been an issue in the past because I'm a big, strong guy. People are always afraid I'm gonna hurt them.
He's got a soft set of hands, though, guys. He's got a
Yeah,
nice soft hands.
I take a lot of effort to make sure I meet you where you're at and make sure you're comfortable over anything else. Because if you're not comfortable, I'm not doing a good enough job. We're not going to get the results we need to get. Just plain and simple.
Great, and yeah, I think that's just the mentality that um, it's going to be a great addition to the team. We're going to be able to help a lot of people out in the community, and really excited for the future. So
Thank
thanks
you.
for
Me
taking
too.
time, Austin, and thanks for all of you for being with us for so many years. Stay tuned. We've got a lot more ahead. So thanks again.